Okay, so here is part 2 of mine and Steph's presentation on radiation in veterinary medicine. So Steph left off with what radiation is used for specifically. So I just want to continue with that a little bit. So external beam radiotherapy can be used on all sorts of types of tumors, such as nasal, oral, tumors of the extremities like on paws, in urethra, bladder, prostate, all sorts of tumors. So brachytherapy, it's only going to be used for cancers that are found deep in the body because it's that internal therapy. And then the biologically targeted therapy, the most common types found in vet med is thyroid adenomas in cats, thyroid adenocarcinomas in dogs, and primary and metastatic bone cancer in cats and dogs. So these are some of the acute side effects that may occur during treatment while using external beam radiotherapy. Alopecia may occur, which is hair loss within the targeted area and surrounding area. You can have skin irritation, such as reddening and/or peeling of the skin. You may have mucositis, which is inflammation and ulceration of mucous membranes, and you can have eye irritation if you're using the therapy near the eyes. That's why we wear those fashionable sunglasses in surg nursing when using the K laser therapy. So the previous slide was more common acute side effects of external beam radiotherapy, and then these ones are less common and they're going to happen later after treatment, months, possibly even years after treatment has ended. So you can have permanent coat changes such as permanent hair loss, where the hair falls out because of treatment and then it just never comes back. You can also have permanent color changes, more likely a darker haired animal, its hair may lighten up, like a black dog could have a white spot where it was being treated. Your animal could have cataracts if damage to the eyes occurred during treatment. And then you could also even have new tumors develop, which obviously you really don't want that. But when you're using radiation, it's damaging cells, it's altering them. And so unfortunately, sometimes you could be damaging healthy cells next to the targeted area, and potentially it could cause gene mutations that could lead to new tumors down the road. These are the side effects of brachytherapy. So with this therapy, there are fewer side effects and less damage of normal tissue than with external radiation. So with brachytherapy, you are using internal radiotherapy directly in the tumor or really close by, so there's limited damage to healthy cells that surround the cancer cells. So some side effects you may have though are just swelling or bruising or pain or discomfort at the site of implantation, and then just general symptoms like fatigue, lethargy, and loss of appetite. So for the side effects for biologically targeted therapy, there really are limited side effects with this therapy. For the most part, any unused drug that is not in the tumor is going to pass through the body. So most side effects that you're gonna see in your patient are just from general anesthesia and the procedure itself. So afterwards you could have vomiting or diarrhea, dehydration, loss of appetite, fatigue, and lethargy. When it comes to radiation therapy, there is a small amount of risk to clients of radiation exposure after their pet has been treated, especially if their pet was treated with one of those biologically targeted therapies, such as radioiodine. So owners should take precautions for about 3 weeks to a month post-treatment. So for instance, they should wash their hands after petting or handling their animal. They shouldn't allow the animal to share a sleeping space, like sleep in their bed or on their couch with them. Children and pregnant women should especially avoid contact with an animal that's been recently treated with radiation. You should keep this animal away from other pets to limit their exposure. You should take extra care when cleaning up urine or feces or a litter box. And don't share dishes with your pet or allow them on surfaces where food is prepared or eaten. And just a friendly PSA that we as vet techs should not forget or neglect our own safety when dealing with radiation in the workplace. So of course, always wear your PPE when working with or near radiation. So that's going to include your dosimeter badge. You should wear a lead apron, a lead thyroid shield, lead gloves, protective eyewear, and protective latex or nitrile gloves when handling other medication. So last but not least, we have to talk about money. So just like treatment of cancer in people, treatment of cancer in animals can be very costly. So a lot of stuff out there varies. It depends on like where you live, certain regions, the prices are just going to be more inflated. Obviously, everything's going to be on a case-to-case basis, but just some generalizations. When we're speaking in terms of external beam radiotherapy, the general estimates lie somewhere between $5,000 to $10,000. This costs, a lot of it has to do with the repeated therapies that are needed for this sort of treatment. Usually this is going to take the place over at least a month, if not longer. So those repeat visits and treatments kind of are what rack up the bill for this sort of therapy. When it comes to brachytherapy, there's a lot of variation and different information out there. Some say that it's more cost effective because sometimes it only takes one treatment, one implantation. And then other sources out there say it's expensive because it's not as common as a procedure, and the little implantation sources that the medication is in are expensive. So this one I had a harder time nailing down an actual price for. But like I said, it's not that common. My general consensus is it is a pricey therapy, though some people said it's not, but I'm going to say it probably could be the same as the external beam radiotherapy, if not even more. And then for the biologically targeted therapy, obviously there's different treatments in this field out there, so some may be more expensive than others, but the most common ones that we see in vet medicine with like radioiodine are actually not that expensive. Most treatments are going to lie somewhere between $1,000 to $2,000. And to wrap it up, here are my references.